Today I'll be talking about seizures or epilepsy, which is also called as fit in simple language. Seizure is abnormal firing of group of neurons, and which can lead that person to an abnormal movements of part of a body or whole body. It is divided into either generalized, where the whole body of the patient is involved, or a part of a body is involved. In that case, it is called as a partial seizure. In this situation, usually patient tend to fall and they will lose the consciousness, or there will be a partial impairment of the consciousness. And patient may have stiffness of the body or a part of the body, where we call it as a posturing, or patient may have abnormal movements, repetitive movements of a part of a body or entire body. In children, there is a epilepsy called as absence seizure. Kid may look like he's not attentive in the class, or he may have a blank stare, and then in few seconds of time he may regain his previous activity. Seizures can be caused by any reasons. There can be a stroke, infection of the brain, it could be a trauma, recent or old trauma to the head, or it could be tumor in the brain, or it could be any genetic cause also. This seizure is a completely treatable disorder. So what are the do's and don'ts which should be followed by our surrounding people? First of all, we have to prevent the injury by preventing the fall of the patient. Just remove any hard objects surrounding the patient so that patient may not get hurt during the seizure activity. And make the patient lie on one side to avoid the aspiration of his saliva into the lungs. Then what are the don'ts? Please do not put anything in his or her mouth, and please do not restrain the patient, and please do not panic. And once the episode is over, please shift the patient as early as possible to the nearby emergency center.